Welcome to UCI Health Department of Medicine Weight Management Program. With us, you'll work with licensed professionals. We've been in business for over 30 years. We're research-driven, always improving, and have a new and exciting program to offer. Our team consists of Dr. Amin, our executive director. I'm Katie Rankel, the program director. My background is a registered dietitian and certified diabetes educator. Our medical director is Dr. No. Our nurse practitioner is Tran. We have 3 dietitians and 1 exercise physiologist, Amanda, Juliet, Natalia, and Susan. And then we have 3 administrative staff that hold the whole program together, Gemma, Melissa, and Kimberly. So this year we onboarded a new vendor and a completely new product line to UCI through Robard Corporation. They've been leaders in weight management since 1976. We've chosen to incorporate their very low calorie VLCD plan, which is medically supervised weight loss on an 800 calorie meal plan. It is intended for people with a BMI of over 30 or over 25 with 2 comorbidity conditions. It's most effective as part of a lifestyle intervention. Research on VLCDs has increased tremendously over the past 10 years and shows consistently positive short-term and long-term outcomes for weight loss and other health benefits. For example, patients who follow a VLCD program have significantly higher weight loss, slower weight gain, and a greater maintenance of weight loss when compared to other approaches. So we are just currently wrapping up doing a pilot program using the new Robard product and their VLCD plan. And we have seen outstanding results after only 7 weeks. So after 7 weeks, everyone enrolled has lost greater than 10% of their total body weight. Females are losing an average of over 3 pounds per week, and males are losing an average of over 4 pounds per week. The CDC states that even modest weight loss, which is considered 5 to 10% of your total body weight, is likely to improve health benefits, such as improvements to blood pressure, blood cholesterol, and blood sugars. Another study has shown for patients with obesity, research has found the greatest improvements to health come from losing just 5% of their body weight. That relatively small weight loss lowered patients' risk for diabetes and cardiovascular disease and improved metabolic functions in liver, fat, and muscle tissue. So that's just with 5%. And on average, the patients enrolled in this pilot we're doing have lost over 10% of their total body weight in just 7 weeks. Some of the patients' feedback has been, love the variety, surprisingly wasn't hungry, simple, less decisions overall, the convenience of the bar was extremely helpful, and great flavors to choose from. So the VLCD plan is 5 packets, which are shakes that can also make into a pudding. There's also 2 soups listed at the bottom, and then 2 bars per day. And those are all the flavors of the bars. So there's a lot more flavors available. You don't need to add anything or use artificial sweeteners to come up with variety. The variety's already there, ready to go. And the bars are true meal replacements, which isn't something we've carried in the past. So getting started would be to schedule your medical evaluation, which is usually $220. Save $100 off that price by calling today, so it would be $120. And you can bring your own recent lab work and EKG, or we can do them at this appointment for you in our office for an additional reduced cash rate. Once you get started, once you're medically cleared, the weekly class and weekly medical visit will be $320 every 4 weeks. You'll purchase your food weekly, and it'll run approximately $140 a week. The body composition test is $50 and will be done every 4 to 6 weeks. And then labs might depend on kind of what we're monitoring, but it will be a discounted UCI pricing, or you can get them done through your own doctor through your insurance. The body composition analysis, we have an in-body machine in our office. So this is something that's part of your initial evaluation to get a baseline. And then we do follow-ups every 4 to 6 weeks because we want to ensure that you're losing body fat and not losing muscle mass. Patients in the pilot study saw a reduction in their percent of body fat just after 4 weeks on the plan. So everyone at that initial redo of the body scan already showed a reduction in the percent of body fat. And then there's a recent study done with the Washington University School of Medicine that showed a 5% weight loss was associated with decreases in total body fat and with much less fat in the liver. We can help you reach your potential. So let's get started. I love this quote. If you really want to do something, you will find a way. If you don't, you will find an excuse. So let's work on reaching your maximum health potential and avoiding the excuses and getting started today. If you want to get started, here's our contact information. You can give us a call, 949-824-8770, or you can email us at weight@hs.uci.edu. And we are so excited about this new program. The outcomes have just blown us away. We're really excited. Just after 7 weeks, I mean, it's been great. And these patients are still going, so we'll have even better outcomes to share at the end of the 12-week pilot. But we're halfway through and it's looking really good. So if you want to get started, give us a call. Thanks a lot.